I'm on.
Good morning.
Good morning.
So this morning we're seeing a patient to be sedated, and I'm just mixing up his cocktail of meds. What I do is I assess how they are. So I give them some medication the night before, and then they take a little bit of a relaxant an hour before the procedure this morning. And so I go in and I talk to the patient. I assess how they are, how relaxed they are on a scale of 1 to 10. I talk to them a little bit, and that helps me determine how much of the other medication that I need to give them. So what I'm doing now is mixing up my medication. I grind it up, and I will end up putting it underneath their tongue. It then does take about an hour before it kicks in, and the patient's fully relaxed. During the whole time, the patient is being monitored, their oxygen levels, their heart rate. We have blood pressure cuff on their arm that goes off every 5 minutes, so we continue to monitor them the whole time. We don't start until they're ready, and there's a couple things we'll do in that first hour that are easier to do, like maybe take x-rays or take impressions, a couple of preliminary impressions if we need to, and then we just let the patient relax until it kicks in.
Very good. I'm going to keep watching you, Dr. Sandra, as you do this. Now, did you have special training?
Absolutely, absolutely. There's special training. Even the state of Illinois requires special training, even for our assistants. So my assistant who will be working with me has received over 20 hours of continuing education. So what I do is mix the medicine, and if anyone has ever taken medicine and didn't completely swallow it all the way, you know that it's a little bit bitter. So what I do is I crunch it up with a little bit of a mint lifesaver so it doesn't taste as bad.
Very nice.
And that's it.
Wow. Okay, so then you're now going to give that to the patient.
Yes.
Very good. Oh, some more.
There's some more. This one. There's a specific protocol depending on the patient's weight, depending on the patient's fear level, and that's how we follow.
I like that grinder.
Isn't that neat?
So all this medication will be given to the patient at one time, under the tongue.
Well, one goes underneath the tongue. This one in particular that I'm grinding has to be in a slurry.
Okay.
So I'll mix it up with a little bit of juice.
Okay.
I usually do juice because, again, it doesn't taste great. So if I did it with water, it's just gross.
Okay.
So I mix it with a little bit of juice.
And what made you want to become an oral sedation dentist?
I think that offering this to patients it's just a good way to practice. There's so many people who are scared of dentistry, especially in the baby boomer generation. They didn't grow up with anesthetic a lot of the time, and so they just have these horrible fears. And it's a good way to just help relax the patients to be able to do the treatment that they need.
Very nice. All right, I'm going to turn this off and then we'll go back in with the patient.
Okay.
Thank you.
Great. Okay, I've got 2 meds for you. One I'm going to put underneath your tongue. So you'll just lift up your tongue for me. I'll put the medicine and then you'll put your tongue back down. Okay? Try to hold it underneath your tongue for as long as you can. If you swallow a little bit, that's okay. All right? And then I'm going to give you a second one, which is a little bit of a drink. Let me give you the drink first. There you go. You got it? Go ahead and drink that. Apple juice-ish. Lift up your tongue. Open a little bit bigger. Okay, drop your tongue down. Just hold that. Okay. A little bit minty. Right? Okay. Very good.
And now we let him sit for approximately an hour.
We're going to let him relax for an hour. Ala's just going to take an x-ray. And then, yeah, we'll just let him relax. We tend to turn off the lights. Either myself or Ala stays in the room the entire time. So if I leave, Ala will be sitting here the entire time, and we'll have that monitored.
Very good. Thank you, Dr. Sandra.
Stanley open? Open? Good, thank you. Okay. A little bit more. Go ahead and open for me. Open, Stanley. Good. And close your lips there. Perfect. Good. Swallow. Okay, let's do a little more. Go ahead and open. Great. And close your lips there for me. Go ahead and close your lips, Stanley. Good, and swallow. Beautiful. Beautiful. Ready for a little more? Okay, good. Let's open up again. Open real big. Big, Stanley. Good. And close. Beautiful. It's time to wake up. Good. Good. And close. Good. Hi there. Good morning. Good morning. How are you? How about a little more to drink? Come on, open up a little bit. Beautiful. And close. Go ahead and close and swallow. Good. Time to wake up. Time to wake up. Time to wake up, Stanley. Time to wake up. Good. We finished everything. You did fabulous today. Everything went really well. We did a lot. We finished everything for you today. Okay? We did some implants up there.